Dr. Crockett and Dr. Sanders with Zeal Integrated Health, and today we're going to talk about back surgeries and just treatment options for back injuries and back pain itself. A lot of people don't understand that just by selecting the physician that you go to first actually dictates your risk of ending up in a surgical situation. And so we were looking at the data on this. What's the percentage if you go to an MD for your first appointment for back pain? What's your percentages that end up in surgery?
42.7% of patients who seek out a surgeon or medical doctor first end up in surgery.
Yeah, so it's a significant percentage of these people are progressing into a surgical outcome. If they seek out chiropractic care, that percentage drops significantly. It was what?
1.5.
1.5%. This is a huge difference just in who you see on your first visit. Now, we know that there's times that somebody needs surgery. We have people that come into our clinic and we refer them out to go see a surgeon because they're losing muscle strength, they're losing nerve function, and so these deep tendon reflexes and some of the sensory stuff is being impacted, and that's they need an immediate surgical outcome to hopefully save those nerves, save those tissues, save that function for that person to be able to maintain a quality life. So we look at surgery as there's a time for it, but a lot of times people are jumping to this because they think it's going to be what ends this for them, and this is going to solve all their problems. But we know that's not true.
That isn't true. So those who undergo surgery, only 50% experience successful outcomes.
Yeah, I'd add to that, only maybe 1 in 4 of these cases that goes through surgery has success further out.
Oh, yeah.
You start looking 5 years down the road, I'd say there's probably another 1 in 4 of those people that are developing a flare-up of the back. And then there's the complications that the surgery might cause itself. When you start fusing segments in the spine, what's that do mechanically to the areas around that?
You completely lose some of your movement where those fusions have taken place, and therefore you lose your curve in your spine that are made to help us maintain our balance and the movements we use throughout the day.
So it impacts balance, impacts our flexibility, and then that's going to put maybe some stress if you're fusing the low back. A lot of times it's going to put stress on the pelvis, on the sacroiliac joints, and those joints get more stress on them. We see a lot of people that have had fusions, they come into our clinic a lot of times just to get some relief in those SI joints. A lot of times people think, hey, I've had surgery, now I can't go to a chiropractor. Well, that's one of the great things about our clinic. We have a pro adjuster. We have the ability to work specifically on these segments with that tool and treat these areas where maybe some other doctors might not be able to do that.
Absolutely. The pro adjuster is a great tool along with our knowledge and therapies to help any patient, whether they've had surgery, have a failed surgery, or have never had surgery, to get them better and healed the way their body should properly function.
Yeah, there's so many things that you can help with these types of conditions. So if you're struggling with back pain, you're considering having surgery done, or you just injured yourself recently and you're looking for treatment options, I would definitely recommend consulting obviously with somebody like ourselves, coming into the clinic for a consult to evaluate whether chiropractic care would be something that can help you with your health and get your health back in your spine, in the back, to restore that function back so that maybe you don't go down that surgical route.